I'm going to be covering light therapy for acute soft tissue injuries, and I decided to come up with a case involving a stage 2 pressure ulcer, which is going to be pretty small here. I've decided to go with LED/SLD clusters in order to treat the stage 2 ulcer. And this is because it's going to be getting at a more superficial depth here to try and, so the goal is to try and heal the tissue, and light therapy can do this by helping ATP synthesis, activating immune cells to fight infection, promoting vasodilation, and then again with soft tissue healing. So some indications for light therapy involve, acute injuries, typically within the first week of insult, and again, this is aimed at reducing healing time. Some contraindications we want to watch out for include avoiding light therapy in patients with malignancy, avoiding it in any patients that have had radiation therapy within 4 to 6 months. You don't want to do it in areas that have active bleeding or hemorrhage, and then you want to avoid the thyroid and endocrine glands as well. Some precautions: if you're pregnant or think you might be pregnant, that's something to watch out for. Being cautious with the epiphyseal plates in kids. And then if you have any impaired sensation, altered mental status, that kind of thing, well, you want to be careful. And then if you have photosensitivity, this might be a treatment that is not tolerable for those patients. So in terms of beginning the light therapy, we want to assess the skin before and after. The parameters that we're going to set the machine to include a wavelength of 600 to 700 nanometers. Again, we're targeting that superficial tissue. The power is going to be machine dependent, but we'll say it's going to be 500 megawatts. And then we're going to set the energy density, and that's going to be within 2 to 8 joules per centimeter squared. So what we're going to do is we're going to clean the area of application. We're going to clean it of any lotions or gels or anything like that. And let's suppose this is on the sacrum. We're going to put protective eyewear on the patient and ourselves, just to be careful. We're going to turn on the unit. We're going to set the energy density as I stated before, and then we're going to set the rate. So again, we're going to be monitoring this patient about every 5 minutes to see how they're doing. And other interventions that could be used for the treatment goal, again, we're looking to heal superficial soft tissue, so things like UVC could be used if it's more of a chronic wound, and then diathermy set to non-thermal effects can also be used to treat something like this.